Hello everybody, welcome to our YouTube channel number 1 Doctor. Today we'll talk about the names of operations as a part of our short medical notes series. The name of an operation typically begins with the name of the structure being operated on, and an ending that indicates what was done. Here is a list of those endings. Tomy means to cut. You might think it means to look inside a part of the body, because you have heard about laparotomies, craniotomies, and so forth. But we have to do a tomy to get in there, because human bodies do not come equipped with convenient zippers. If we cut a tendon, that is a tenotomy. If we slice open a fistula so it can fill in and heal, that is a fistulotomy. And so on. Ectomy means to take out or to resect, as an appendectomy or cholecystectomy. Where there are different extents of what comes out, the name specifies it clearly. We can do total gastrectomies, subtotals, or hemigastrectomies. Or a right hemicolectomy, as opposed to a left hemicolectomy. Enough said. Ostomy means to make a mouth, to make an opening. But this one is tricky. If the name of a single organ precedes the suffix ostomy, the opening is to the outside, as in colostomy or ileostomy. It could be done directly or by means of a tube or cannula, as in gastrostomy, tube or tracheostomy. But if the names of two organs precede the ending, the opening is between them. It is an anastomosis. In the GI tract, anastomosis is always designated in the normal anatomical sequence, as in gastrojejunostomy. Medical students trip on this one all the time. They read, a patient had a right hemicolectomy and an iliotransverse colostomy, but they retain only the last word and start looking for the colostomy bag. There isn't one. The ileum was anastomosed to the transverse colon. Plasty means to change the shape of something. Virtually all the cosmetic plastic surgery procedures are plasties, but we also do them for functional reasons. For instance, a pyloroplasty enlarges the outlet of the stomach and annuloplasty brings the leaflets of the mitral valve closer to each other, so the valve can close. Pexy means to fix in place. For instance, orchiopexy fixes an undescended testicle where it should be. Many times we pile up a ton of procedures as part of a single operation. For instance, we might do a hemigastrectomy with a gastroduodenostomy and, to provide decompression, add a tube gastrostomy, but fearing complications if the tube is dislodged, we add a gastropexy. Raphy means to suture or sew together. Herniorrhaphy is the classic example for historical reasons, because surgeons used to sew up layers and layers of groin tissues to fix hernias. Today we often just laparoscopically put in a patch of plastic material. So here is another example. When ophthalmologists do fancy stuff that they want to protect from exposure to the outside, they add a tarsorrhaphy. They sew up the eyelids together. Scopic implies that an operation, or part of it, was done in a minimally invasive fashion using a TV camera inserted into a body cavity and several probes that do the actual operative steps. The term is derived from scope, which means to see. Thanks for watching. Please like and share. With my best wishes. Dr. Atef Ahmed. Wishes.